Good afternoon, ladies and gentlemen. My name is Paul Rowe, and I am an EMTB, and I am certified nationally and state licensed to perform as an emergency medical technician basic level. I'm also BLS certified basic lifesaver certified through the Navy and the American Heart Association. I'm also a combat lifesaver and a combat aidsman certified by the Department of the Navy. First, let's take a look at how to tell if a child needs CPR. First thing you're going to do is patient evaluation. First thing you're going to do is come up to a patient that's passed out or unconscious. You're going to ask that patient if they're alright or if they're okay, shaking them gently.
Are you alright? Are you okay?
If there is no response at this point in time, what you're going to want to do is assign a person to call for 911.
You call 911.
You want to make sure that you have eye contact with that person fully understands that they are the ones responsible for calling 911. The next step is going to be to look, listen, and feel to assess the ABCs. The AB stands for airway, breathing, and circulation. The first thing you're going to do is do a head tilt chin lift on this patient. It's where you grab the top of the forehead and the chin and elevate the chin towards the sky, slightly moving the head backwards. Next thing you're going to do is place 2 fingers on the carotid artery of the patient closest to you. What you're doing here is you're checking for the pulse of the patient. Next, you're going to place your face next to the patient's mouth. By doing this, you're checking for the air coming up onto your face and also listening for the breath sounds. While you're in this position, you're going to be wanting to watch the rise and fall of the chest to see if there's any signs of breathing. If none are found at this point, you're going to need to begin CPR. The first thing you're going to do when beginning CPR is you're going to go ahead and give the patient 2 rescue breaths. While the patient is in the head tilt chin lift position, you're going to go ahead and give 2 slow breaths. In between every breath, you're going to look at the patient's chest and look for rise and fall. If you do not see rise and fall of the chest, you're going to reposition the head through the head tilt chin lift maneuver and give 2 rescue breaths until 2 breaths fully enter the chest cavity. Next, you're going to start performing chest compressions. To perform chest compressions, you're going to find the xiphoid process. That's the center point of the rib cage on the patient. After you found that, you're going to place 2 fingers at the very top of the xiphoid process. You're going to place your palm on the top of your 2 fingers and then slide your hand with the 2 fingers out from under that and interlock with the hand that's down. You're going to perform 30 rapid chest compressions, compressing down to 1 inch to 1.5 inches for every compression.
1, 2,
you're going to want to make sure you're counting out loud.
5, 6,
this way you know where you're at,
9,
and if somebody else comes up to join the rescue, they know where to join in.
15, 16, 17.
You're going to be wanting going a little bit rapid, more rapid than what's going on right now. You want 100 compressions within 1 minute's time.
27, 28, 29, 30.
After you reach your 30 compressions, you're going to go ahead and offer 2 rescue breaths to this patient. You're going to want to reposition the head through the head tilt chin lift to give this child the rescue breaths. Again, you're watching for the rise and fall of the chest. You're going to go through 5 cycles of this 30 compressions to 2 breath ratio. After that, you're ready to move on to the next step. That was a demonstration of the 1-person CPR. For a 2-person CPR rescue, the only difference is 1 person is going to be providing breaths and 1 person is going to be doing chest compressions. The ratio changes from 2 breaths and 30 compressions in a 1-person rescue to a 1 breath every 15 compressions for a 2-person rescue. That's really the only difference. Just make sure you're talking with that other rescuer when you're doing the rescue. After you've done those 5 rescue breaths, you're going to go ahead and reassess the ABCs of this patient. Again, you're doing the head tilt chin lift, opening up that airway. You're going to be placing your face up against, not up against the mouth, but close to the mouth so that you can feel the breath. Also, you're going to be placing 2 fingers on the carotid artery, feeling for a pulse, and you'll be watching for the rise and fall of the chest. If nothing is present after this, you go ahead and do another cycle of 5 sets of 30 compressions to 2 breaths for 5 cycles, and you reassess the patient. You continue this until you either tire out and can physically not continue on with the CPR, or once the EMTs and paramedics show up and they have a higher level of knowledge than you, then they can take over the CPR at that point in time. If your patient is conscious and not necessarily conscious, but if your patient is responding at this point in time, what you're going to want to do is enter the recovery phase portion of this CPR. What you're going to do is the arm closest to you on the patient, you're going to place that above the head. Very good. And then you're going to take both hands, place one on the shoulder of the patient, but you're going to want to not cross your arms. So you're going to want to put the arm closest to the hip on the hip. Very good. And then you're going to take your other arm and place it on the shoulder of that patient. You're going to slowly roll that patient towards you, and once you reach halfway, you're going to stop. The upper leg, you're going to pull that towards you just enough so that you can bend the knee and place the knee firmly on the ground. Then the arm that's up in the air, you're going to want to place that down at the patient's side around their chest. It's kind of hard to tell with this dummy because it's not an actual person, but what you want to look for is having the head resting on the arm, the upper knee touching the ground, and this hand acting as a brace. That's basic recovery position. And then once you're in this position, this opens up the airway for the patient and also keeps them in an upright position, so if they vomit or anything else, they'll expel at this point. Now you're going to want to place a blanket on top of the patient to keep them warm in case they do enter shock. Very good. Now you're going to keep them in this position until the EMTs or paramedics arrive, at which point you're going to want to tell the EMTs and the paramedics everything that you have done to revive this patient. And the reason we want to pass that information on is so that they can pass that information on to the doctors and caregivers at the ER so that they can further assess this child and help this child live. Today we have discussed how to properly perform CPR on a child. In doing so, you greatly increase the chances of this child to survive. We discussed how to determine if a child needs CPR, the proper methods of administering rescue breaths and chest compressions, and also the proper recovery position as the patient's in now. I hope that I have been able to inspire you to attend further classes on CPR, because you never know when you're going to need to save the life of a child.